Hello, everyone, and welcome. This is Susan Lopresti, and I am very grateful to have you here with me today for this presentation. So for those of you who don't know me, I am a holistic health coach, a Reiki and meditation practitioner, and I mainly work with women who are beginning to notice changes in the way they look and the way they feel due to aging. And I help women to reclaim a lot of their health through alternate healing modalities. I believe that we should be proactive with our health. So we don't want to wait until we get sick before we start taking care of ourselves. We want to know what it is that we need to do in order to prevent disease from happening. Now, today I want to talk about strokes and, what goes on with them, why they happen, the different types of strokes, and the prevention of a stroke, because a stroke can definitely be deadly. And if you survive, there's a good chance that you may be paralyzed or you can't speak. There's like a whole bunch of complications that come along with a stroke. So being proactive and staying healthy is what my goal for all my clients is all about. And so a stroke happens when blood flow to an area of the brain is cut off. And blood carries oxygen to cells in the body. When those cells aren't able to reach the brain cells begin to die. And so a stroke is definitely a medical emergency, and it's important to get treatment as soon as possible. Some treatments only work if given within the first 3 hours, and a delay in treatment can increase the risk of permanent brain damage or death. So there are 4 major signs of a stroke that you should be able to recognize. So F is when you see someone's face is drooping. Ask the person to smile. Does that one side droop? If it does, that's definitely a sign of a stroke. Also, arm weakness. Ask the person to raise both arms. Does one arm like drift downward? Are they having a problem holding their arms up? And then S, speech difficulty. Ask the person to repeat a simple sentence. And if those words are slurred, there's a good chance that this person is having a stroke. And then T, time to call for help. If a person shows any of these signs, call 911 or your local emergency hotline if you have one. And then there's more symptoms to also look for. The FAST test that we just discussed covers the most common symptoms of a stroke. Other sudden symptoms that someone having a stroke may feel can include numbness or weakness in the face, in the arms or legs, especially on one side of the body, confusion or trouble understanding people as they're talking to you, difficulty speaking yourself, trouble seeing with one or both eyes, problems walking or staying balanced or coordinated, and also dizziness. Now, a lot of these symptoms could be something else. So you really don't know. And with something like a stroke, you don't want to take a guess and say, oh, I think it's a migraine headache, because some of these symptoms that I just read off to you actually are symptoms that you would get with a migraine headache. But they won't be super severe. And if these are like that, super severe, you really need to call 911. And then also a severe headache that comes on suddenly, that can also be a sign of a stroke. And like I said, every minute counts. Calling a doctor or driving to the hospital yourself wastes time. Ambulance workers can judge your situation sooner, which boosts your chance of getting the potentially life-saving treatment that you just may need. If you have noticed any of these symptoms that I have talked about so far, call for an ambulance if this comes up. Even if you're not sure, it's so much better to be safe than sorry. There are three main types of strokes. The first one that I want to discuss is the ischemic stroke, also known as a stroke caused by a blood clot, which accounts for about 87% of all strokes. An ischemic stroke occurs when fatty deposits lining the walls of the blood vessels start to obstruct blood flow. And there are two types of obstructions that can occur. One type of obstruction that can occur is called cerebral thrombosis. This occurs when a blood clot forms in the brain's venous sinuses, and that's a channel between the veins in the brain, and it prevents blood from draining out of the brain. As a result, blood cells can break and leak into brain tissue, forming a hemorrhage. This type of stroke can happen in people of all ages, including children and even newborns. The second cause of obstruction is referred to as cerebral embolism, and this is a blood clot that forms at another location in the circulatory system, usually the heart or large arteries of the upper chest and neck. Stroke occurs when part of the blood clot breaks loose. Excuse me, let me grab some water for a second. Stroke occurs when part of a blood clot breaks loose, and it enters the bloodstream and it travels through the brain's blood vessels that are too small to let it pass. A leading cause of an embolism is an irregular heartbeat, which can cause clots to form in the heart, dislodge, and travel to the brain. And then there are hemorrhagic strokes that account for about 13% of stroke cases and are caused by a weakened vessel that ruptures and bleeds into the surrounding brain, and it accumulates and compresses the surrounding brain tissue. Two types of weakened blood vessels usually cause a hemorrhagic stroke: aneurysms and also arteriovenous malfunctions, which is AVM for short. However, the most common cause of hemorrhagic stroke is uncontrolled high blood pressure. An aneurysm is a weak area in a blood vessel that usually enlarges. It's often described as a ballooning of the blood vessel. They expand slowly and become weaker as they grow, just as a balloon becomes weaker as it stretches. People usually aren't born with aneurysms. They can form from blood vessel disorders, infections, drugs such as amphetamines and cocaine, or direct brain trauma from an accident. If one aneurysm forms, there's about a 20% chance that at least one other one will form. Small aneurysms don't have any symptoms, but as it enlarges, it can produce headaches or localized pain, and it expands. It creates pressure on the brain tissue or adjacent nerves. Typically, arteries carrying blood containing oxygen from the heart to the brain, while veins carry blood with less oxygen away from the brain and back to the heart. When a AVM occurs, a tangle of blood vessels in the brain bypass the healthy brain tissues and directly divert blood from the arteries to the vein. Brain AVMs occur in less than 1% of the general population and are more common in males than in females. Usually someone is born with an AVM, but they're not inherited from parents and likely won't be passed on to children. As the heart beats, it pumps blood around the body through a network of vessels called arteries, so that muscles can get the energy and the oxygen that they need. As the blood travels through the arteries, it's pushed against the sides of the blood vessels. The strength of this pushing is called blood pressure. As your heart squeezes and pushes your blood through your arteries, your blood pressure goes up. As your heart relaxes, blood pressure goes down. With each heartbeat, your blood pressure will rise to a maximum and fall to a minimum. The duo of numbers is shown as one number over another, which translates into the reading you get at a doctor's office. High blood pressure can significantly increase the risk of hemorrhagic stroke because it means that your heart is under more stress and working harder to transport blood. Men, the elderly, people who smoke, and people who drink alcohol, coupled with high blood pressure, are at even higher risk. Also known as a mini stroke, a TIA is a major warning that your body is not functioning at its best and that a full-blown stroke is ahead. A TIA occurs from a temporary blockage of blood flow to the brain, but the body fights back quickly by pushing the TIA back downstream or by using natural clot dissolvers. Therefore, the blockage isn't in place long enough to do any damage. And here are some statistics about TIA that you should know. A TIA happens before about 15% of all strokes. Up to 25% of people who suffer with the TIA die within 1 year. And about 1/3 of people who have a TIA go on to have a more severe stroke within 1 year. Anyone can have a TIA, but the risk increases with age. If you've previously had a stroke, pay careful attention to the warning signs, which are the same as a stroke. So think FAST, F-A-S-T. Can you recall what FAST stands for? 1 in 5 women in the United States will have a stroke in their lifetime, and a stroke kills twice as many women as breast cancer does, making it the 4th leading cause of death for women. Stroke kills almost the same number of men each year as prostate cancer and Alzheimer's disease combined. These statistics come as a shock to many people, but the good news is that 80% of strokes are preventable. That's right, you heard that right, 80%. And I'm going to get to that in a few minutes. Let's talk first about what puts some women at risk more than others. So number 1, high blood pressure. 1 in 3 women have high blood pressure, and only about half have it under control. Also, certain types of birth control medication also play a role in a stroke. Certain types of birth control medications can also play a role. African Americans are more likely to have a stroke than any other group of women in the United States. And they're also more likely to have a stroke at a younger age. This could be part that African Americans tend to be diagnosed with higher rates of high blood pressure, obesity, and diabetes. Additionally, African Americans tend to be more sensitive to salt, and too much sodium can lead to high blood pressure. Lastly, sickle cell disease, a common genetic disorder in African Americans, can also lead to a stroke. Compared to non-Hispanic whites, Hispanics have strokes at a younger age, while the average age for stroke among non-Hispanic whites is 80. Among Hispanics living in the United States, it's 67. Scientists don't know exactly why certain ethnic groups are at a higher risk, but they believe lifestyle and social factors may play a role. And I believe that to be 100%. Prevention. So what could we do? So the first thing we want to do is we want to lower our blood pressure. High blood pressure can double or quadruple your risk for stroke if it's not controlled, and is the most significant contributing factor to risk in both men and women. So you're equal in this respect. Your ideal blood pressure goal should be less than 135/85, but for some, a slightly higher goal may be more appropriate. So what do we do to reduce blood pressure? Reduce your salt intake. No more than a half a teaspoon a day. Avoid high cholesterol foods like red meat, fried foods, cheese, and ice cream. Eat 4 to 5 cups of fruits and vegetables every day. 1 serving of fish 2 to 3 times a week. If needed, take blood pressure medication. Another way to prevent a stroke is weight loss. Obesity, as well as the complications linked to high blood pressure, diabetes, raise your odds of having a stroke. If you're overweight, losing as little as 10 pounds can have a real impact on your risk of a stroke. Knowing your BMI and work with a health professional like myself to create a personal weight loss strategy if you're in an unhealthy BMI range. And there's a calculator, I'll put the link in the notes, where you can calculate your BMI. And then the next prevention is physical activity. Exercise contributes to weight loss and helps to lower blood pressure, but it can also stand alone as a stroke reducer. And here are some ways to get a little bit of extra movement into your day. Take a walk around your neighborhood. If you have a dog, by all means, take them with you. If not, you could sign up to walk for an app like WAG and earn a little bit of extra cash while you're walking. Try an exercise class with friends. Take the stairs instead of the elevator. Park a little further from the entrance of stores where you're shopping at, or to your job, or to your house. A few tips to keep in mind. When you do exercise, reach a level where you're breathing hard, but you can still speak without totally losing your breath. Aim to exercise for 30 minutes per day. If you can't block out 30 consecutive minutes, break it up in 10 or 15 minutes throughout, each session. So I like to walk 2 hours a day, but sometimes I don't have all that time. So I'll do 1 hour in the morning and then 1 hour before sunset in the evening. And then you want to treat arterial fibrillation. That's a form of an irregular heartbeat, and it causes clots to form in the heart, which can travel to the brain and produce a stroke. Those who have arterial fibrillation are almost 5 times more likely to suffer a stroke. So treatment should be taken very seriously. The next prevention is to treat diabetes. Having high blood sugar damages blood vessels over time, making clots more likely to form inside them. Keeping your diabetes under control by monitoring your blood sugar as directed by your doctor and using diet, exercise, and medicine if you need to keep your blood sugar within the recommended range. Additionally, know your risk for prediabetes as well. 1 out of 3 people have prediabetes, but 90% of those people don't know it. You can test your risk. I'm going to leave a link where you could take the test. And the next prevention that I want to talk about is to quit smoking. Smoking cigarettes accelerates clot formation by thickening your blood and increasing the amount of plaque buildup in the arteries. Therefore, quitting your smoking habit is one of the most powerful lifestyle changes that will help you to reduce your risk of a stroke. Don't be afraid to ask for help. What worked for your friend might not work for you. Find a professional to help advise you on the most appropriate way for you to quit, not how your friend quit. Know that most smokers need several attempts, I know I did, before quitting for good. See each attempt as bringing you one step closer to successfully beating the habit. On that note, I want to thank you so much for being here with me today. I hope that this presentation added value to your health, to your knowledge, and it's going to make you be a little bit more proactive in taking some of those prevention steps that I just laid out for you. So again, thank you so much. Until the next time, be well, be happy, and bye for now. Take good care.